What's up, y'all? Thank you for tuning into my channel. I'm right here in Tampa, Florida. Doing a rotation in emergency medicine, doing an away rotation. This is my last one actually. And I just want to kind of tune in and talk to you guys about geriatrics that I did last month. It's a required rotation, your 4th year of med school at Florida State. Some other medical schools don't require you to do geriatrics. I'm just going to talk a little bit about what geriatrics is and what I did on my geriatrics rotation. It's another specialty that you can do. It actually is a specialty that you can pretty much do with family medicine or internal medicine if you do a residency in that for 3 years. But there's also a fellowship, I believe, that you can do in geriatrics alone after those 3 years. I think for about a year or so, that you can actually just be a full-blown geriatrician. So what's geriatrics? Geriatrics is actually the specialty that deals with, cares for, maintains health for elderly patients. So I would say about 60, 65 and up. As soon as Medicare kicks in, that's when geriatrics kind of takes over. Actually, primary care doctors can actually take care of the elderly people, but there are geriatricians that specialize in taking care of elderly population. Because these folks have like a lot of medications on board, there's a lot of interactions between medications. There's this thing called the Bears criteria, and it's a list of medications that you actually shouldn't give to people over 65, 70 years old because it can have bad side effects. And some of them are very common medications, like over-the-counter medications. It can cause them to get lightheaded, dizzy, it can mess with their heart, mess with their blood pressures, stuff like that. And these are a lot of medications that we commonly use, And so, geriatricians are basically like masters at understanding and identifying those medication combinations that the patient might be taking and that could be harmful to them. And health maintenance, they focus on that as well. Make sure they're getting all the screenings they need to for cancers and whatnot, and also make sure that they're getting the appropriate vaccines for their age range, because a common cause of elderly death when a person is actually like pretty much healthy and they end up going to the hospital and they die is from sicknesses. Pneumonias are very common that they actually get most of the time in the hospital, and then they can actually die from that pneumonia that they actually got in the hospital. But sicknesses, viruses, and bacteria that can kind of get into their system, and because their immune system's depressed, because they aren't 30 years old anymore, these are things that we kind of look out for. So that's what geriatrics is in a nutshell. My geriatrics rotation was 4 weeks long, and it was actually in the hospital. So geriatrics is obviously in the hospital, but the specialty mostly is in outpatient clinics. So some nursing homes actually have clinics attached to them, and doctors actually come and see the patients there. Some doctors actually have an outpatient clinic where they just see the patients that come. Some are at assisted living facilities. There's different types, but mainly the patients are coming for acute care or for chronic care. So for something like a blood pressure stabilization or for diabetes that they need to kind of control, they kind of go on their yearly visits or half a year. And also acute problems. So we have a patient that comes in with that she's feeling a little depressed, she's sad that she can't drive anymore, and we want to kind of focus on, man, should we do therapy on this patient, or should we do a medicine, or a combination? And these are things that is a little different in treating an older person, because of all these other things I talked about. That's pretty much what an outpatient clinic would look like. What I did actually was in the hospital, which is, in my opinion, a lot more fun. I'm going into emergency medicine, so I'm going to be literally in a hospital all the time, unless I do like an outpatient, like urgent care or something. But basically, I was in the hospital, and I would go in the morning, round on my patients, see all the patients that were basically 65 and up, see what they were in there for. Maybe I got some from the emergency department, and we got them admitted to the hospital. So I would follow them up. And actually, what the cool thing about this rotation, I actually got to follow a couple patients after they got discharged from the hospital, and we got to follow them to like the extended nursing care facility that they had to go to for like 2 weeks just for physical rehab to get them stronger until they actually go back home. So I got to actually follow them to those places and saw them in that nursing home area before they got discharged back home. Physical therapy was on board, occupational therapy was on board, the whole nursing staff. And so you see a collaboration within the group, and that everybody is important. Every healthcare provider, from a nurse to a PA to a nurse practitioner to the occupational therapists, physical therapists, speech therapists, the LPNs, the medical assistants, everyone's important in one patient's care. And I think that's probably the best thing that I've learned from this rotation. That is probably the thing that I took away from this rotation, is the teamwork that must be involved in getting a patient, especially an elderly patient, in a hospital, get them safe in the hospital, get them safely discharged from the hospital, focus on what we need to treat, and then have them discharged safely, effectively, more, healthier than they came in, and having them go follow up with a primary care physician like a geriatrician after they get out of the hospital. So, I learned a lot from this rotation. I think the coolest thing was just kind of talking to these patients, and a lot of them were like, veterans, and some of them just have like a great life story, memories that they can just share with you as a med student. I just took a lot out of this rotation, more than just the medicine side. I took a lot about like just human life, like the precious quality of life. And a lot of people that are over 65 and 70, they get actually kind of derailed from the community. People just kind of forget about them because their time's up, and they've lived their life already. So let's focus on the younger people. But really, it's like, it shouldn't be that way. These people, even though they're 70, 75 years old, they still want a quality of life. They still want to be able to go outside, take a walk, maybe ride their bicycle, maybe, go take their grandkids to the park. They still want to do these things. It doesn't just stop, when you turn a certain age. No, people want to have good lives, and so our job as providers, healthcare providers, is to make sure that we can allow them to have the best quality of life with what they have. And how can we improve with what they have already, So, that's what I took out from it. Right now, I'm actually in Tampa, Florida, doing an emergency medicine rotation. This is kind of, where we live. I know it's like a vacation home, but not really. It's just, this is where I grew up. A blessing, honestly. But I'm actually staying here. Jessica's with me. We're staying here for a month, and I'm gonna be at the hospital here. And man, we're gonna just have a good time. I'm gonna work hard, and I'm gonna play harder, baby. So I'm gonna have a video coming up on how I studied for step 1. I'm gonna have, maybe some people's inputs on what else to use, but I'm gonna tell you guys, for your board exams, for those of you that are in med school, or for those that aren't, just what is the step 1? Because when you get into medical school, testing is not done. You have a lot of tests, and people are like, man, how hard is it? Like, how hard do you work? Like, how much studying do you have to do? And I'm just gonna talk about the main tests that you take during medical school, and how you study for it, and how hard is it really? And if your undergraduate scores, maybe your MCAT, maybe your SATs, and all these things that you take before med school, if those really correlate with how well you're gonna do in med school. I'm gonna talk about that. So love you guys. Comment below. I'll try to reply and read the comments and all that. Love you guys. God loves you, and we love you. Peace. Take care.